Joining us here today on Primetime Local News is MLA Colleen Young. Colleen, today we're talking about the vaccine and the distribution in Lloydminster specifically. We know over 2,000 doses were given, but what's the latest on that front for people getting their second doses, and also kind of what's the holdup for the rest of people that still need their first dose in the area?
Well, as you know, they have been the Moderna vaccine, the Pfizer, sorry, excuse me, the Pfizer vaccine has been administered, the first doses to our long-term care facility residents, Jubilee Home, as well as the frontline healthcare workers there. And to our northern Indigenous communities, there was about 450 vaccines went to the north there. AHS came in and did all the long-term care facilities on the Alberta side, as well as Pioneer House, and SHA did the Pioneer Lodge portion of that. So all of our long-term care facilities and with our residents and our healthcare workers have had their first shot of vaccines. Our challenge right now is ensuring that our second doses come in a time frame that makes that first dose effective. So that's where the challenge is. We aren't receiving any more Pfizer vaccines currently from the federal government. We will get some Moderna ones still here at the end of February to administer second doses. So, you know, we've done what we can with what we've gotten and gotten it out and around the province, but there are still a number of areas that haven't even had their first doses. So, and the challenge is that getting those vaccines that the federal government promised that we would get.
Now, the University of Saskatchewan did announce trials for a COVAX-2, which is a vaccine developed by the Vaccine and Infectious Disease Organization. Was this something that Scott Moe knew was happening, and is it going to possibly be considered as a solution for when it comes to distributing the vaccine in the province that need their second doses, or places that still need their first doses even?
Well, we know that back last year, even in March and April, our University of Saskatchewan was already doing research on the COVID-19 virus, and they were doing some trials already that were shipped off down east to Montreal and were being tested. So they've moved that process along, and right now they are at a stage of doing some more trials and are hoping that the FDA will approve the vaccines that they would like to produce here in our own province. If it's their vaccine and it's a first dose, you have to stick. Typically, what I understand is that you have to stay with the same vaccine that you had the first time. So if you receive the Pfizer vaccine, you must take a Pfizer vaccine as your second dose. Moderna first, second dose as well. It has to be Moderna. So based on whatever vaccine you received the first time, you have to stay with that same vaccine.
How much vaccine talk are you hearing here in the area, Colleen? I know the government is doing what they can to get the vaccine out. So how constant do you keep hearing and getting questions from residents about when people are going to get their first dose?
I do receive calls. I receive emails from folks wondering how they can get on a list. And as we know that there is an immunization oversight committee, of which all the provinces have representatives on, and have been the ones who have been making the determination as to how the vaccines will roll out, but also as to who will receive them first and in which phases. So it was set up in phases. And as we know, it was determined that the vaccines would go to the most vulnerable areas where we had seen outbreaks to begin with. So that is our long-term care facilities in the province, but then also to our northern Indigenous communities where we know there were outbreaks early in last spring already and even into the fall. So that then became the 70 plus after that. And that's where I'm getting calls, as everybody's saying, so how do I get on a list? Where do I call? What do I get? How do I do this? And it is very frustrating because of the fact that that hasn't been set up yet, because of the fact that we don't know when we're getting vaccines and which ones we're getting. So that is the biggest challenge. Is yes, people would like to know when they're supposed to be getting vaccines. And we are hoping that, you know, the federal government will still come through, and we will be able to start doing the general public probably by June, we're hoping.
Well, Colleen, I really appreciate your time. Thank you very much for joining us today.